Afternoon. Thank you for being here today. Today we have a significant jump in reported cases of COVID-19 in Lafayette Parish. We currently have 118 confirmed cases, which is up from 82 from yesterday. In line with the guidance we have received from President Trump, we again urge our people to stay home whenever possible. Wash your hands frequently, practice social distancing, and avoid private social gatherings such as house parties, block parties, or really any gathering that requires 10 or more people. We also ask that you observe times that businesses have set for the elderly, usually the first hour of operation. It's important that we give our most vulnerable citizens the confidence to do what they need by respecting these special accommodations. We want to strongly encourage our large retailers to be more diligent in implementing social distancing policies within their establishments, including the policy of one buggy, one person, as we discussed yesterday. The stay-at-home order issued by the governor, extended through April 30th, is based on federal guidance from the CDC and the Department of Homeland Security. Some of the nation's top public health experts are advising President Trump and helping guide policy at our federal agencies. It's important that our citizens understand that our local policies in this public health emergency are in line with the federal response, the governor's emergency declarations, and in consultation with our local and regional medical experts. I want to take this opportunity to thank Congressman Clay Higgins for securing an $850,000 community development block grant from the Department of Housing and Urban Development for LCG's Community Development Department. So thank you, Congressman Higgins. This HUD funding from the CARES Act, the President's recently passed economic recovery package, gives broad discretion for the use of these funds in meeting local needs. We will be working with local stakeholders to determine the best use of these funds. Now this weekend, I received a text message and had a subsequent telephone call with a personal hero, Drew Brees. As you know, Drew and Brittany Brees have committed substantial resources to help Louisiana in this public health emergency. I spoke with Drew about the work of the Brees Dream Foundation, specifically their efforts to help meet the needs of the local workers in the service industry and other personal service industries who find themselves suddenly unemployed through no fault of their own. Drew has graciously offered to fund meals for our local unemployed who do not yet have access to nutrition benefits or who may be food insecure. As a result, daily meals available at lunchtime are being funded by the Brees Dream Foundation and provided by walk-ons and other local restaurants. LCG is providing logistics to support this effort, utilizing personnel who are not currently tasked with other duties. I want to thank Drew and Brittany Brees for their efforts to support the people of our great state during this public health emergency. Drew is an active and engaged member of our local business community. In fact, we just got off the phone a few minutes ago to talk about today's efforts. It became apparent in our conversation that Drew cares deeply about Lafayette and our response to the COVID-19 emergency. Again, I am grateful for his commitment to our community. On our first day at the Robichaux Center, we served 200 meals in 45 minutes. Today, we serve chicken sandwiches and waffle fries from walk-ons. Tomorrow, we plan to have 450 box lunches available on a first-come, first-served basis. Now, I want to emphasize that these meals are for people who are recently unemployed and who do not have access to other nutrition benefits. Workers in the service industry, personal service providers such as massage therapists and hairstylists, or the unserved population we are working to reach with this initiative. If you already have benefits, nutrition benefits, please respect the purpose of this effort so that others can get what they need. Now, switching gears. Tomorrow is Census Day, April 1st. As you may know, the results of the census form the basis for our representation in Congress, as well as formulas for federal funding in a full range of programs. For the first time, Our citizens can participate online, by phone, or by mail. More information on how to respond is available at 2020census.gov. I want to urge our people to please take time to participate in the census at your earliest convenience. It's not only required by law, it's also incredibly important to ensuring our state and our parish receive everything we should to help our citizens. I have time for a few questions. Any questions of me? We also have Dr. Stefanski that can answer medical questions, and our Chief Law Enforcement Officer, the Sheriff, is with me as well.
Y'all reached out to Drew Brees, or they contacted y'all?
Over the weekend, Drew had reached out to me via text message, and we had a subsequent telephone call.
The block grant from HUD, that was part of the CARES Act, you said?
Yes.
Okay. Where do you think we should go?
We're going to work with our stakeholders. Christian, I just found out about it probably an hour and a half, 2 hours ago. And I want our people out here to know how hard we're working, not only locally here, but our Louisiana delegation in Congress, our representatives. We had a representative, Jonathan Goodo, that came out to the Cajun Dome screening site. And Jamie will be able to provide more information on the Cajun Dome here shortly, and also our efforts with LEDA. But if I were sitting at home, I would want to know that my elected officials were on the same page. So again, thank you to Congressman Higgins. Thank you to his staff. Thank you to our entire Louisiana delegation up in Washington, and also our Lafayette delegation in Baton Rouge.
You said you'd like to see large retailers follow social distancing guidelines better. Have you been seeing people using more than one buggy or more than a couple people at one buggy? And why are you calling larger retailers to take this action? Have you seen anything that concerns you?
Yeah, Neil, so yesterday we had discussed that we've gotten a lot of calls in at LCG in regards to retailers that are not observing the social distancing guidelines, really being echoed from the federal level, from our president, to the state level, our governor, and here locally. Social distancing is the most effective way that we're told by our medical experts to combat this deadly virus on the front lines. So I urge all of our large retailers, all of our small retailers, to exercise the one person, one buggy initiative. If you can get away with it, and you don't need to bring your entire family into the shopping center. You don't have. I think Walmart over the weekend had started the one person, one buggy initiative, and I thought it was a pretty good rule of thumb, and we need to exercise this not only in Lafayette Parish, but again, my fellow parish presidents have asked me to echo this across Acadiana. Any other questions of me?
Yes. Again, I ask this every time, I guess, but I'm still getting questions from people. When is LCG going to start doing something about a large number of people blatantly ignoring the stay-at-home?
So Claire asked, I don't know if did the microphone pick it up for a reason? Okay, just in case you didn't hear it, Claire had asked, what are we going to do about large gatherings? I would ask the sheriff to come up. Again, our sheriff is our locally elected chief law enforcement officer of the parish. We stand shoulder to shoulder in this public health emergency, and I'm very thankful that the sheriff took the time to come and be with us today. So thank you.
Thank you, Mr. President.
Okay, Claire, I'm sorry. I still couldn't hear it because I was back behind a couple of pillars, but you're asking what are we going to do about large gatherings?
Questions from people.
Okay, so, we're going to take it on a case-by-case basis. Like I'd previously discussed, there are different reasons that people are getting together. I don't think there's many people at this point who are not aware of the governor's order. Who are not aware of the national and worldwide crisis that we're having with this. What I'm going to be looking for is to inform the organizers of the gathering first that they are violating an executive order and that is punishable by criminal penalties. We inform them of that and we ask them to disperse. And then if they don't comply with that, then we'll take enforcement action. We're going to look at the spirit of what they're doing too. If you say, well, there's more than 10 people in the building and it's a horse arena, and they're all spaced out 20 yards apart from each other, and there's 12 or 15 people, then is that the right kind of violation to enforce strictly? No, it's not. On the other hand, if there's a discretionary activity like an adult birthday party that was happening yesterday in one of our towns in the parish, for example, that initially refused to disperse. That was something that was ultimately dealt with by that chief of police, but it was not without consultation and some planning to take some enforcement action. And I felt like, that these people were deliberately violating the spirit of the law and endangering not only themselves, but you endangered other members of the public. I think what people need to realize is that this is not just about yourself. You can't simply make a decision that, well, I'm going to be okay with being exposed to other people or being in close proximity, because if you spread the virus, then you are affecting your neighbor. You are directly affecting the youngest and oldest, and in fact, every member of our community, because I think what we know now about the virus is that there's every single age group is likely to catch it, and you don't know until you get it whether or not you're going to have very severe reactions to it. And I'm going into these tangents so that the public can understand why we're going to take these actions, why we're going to ultimately enforce what I personally, wouldn't agree with under any other circumstances, which is, to take away someone's constitutional rights of assembly and so forth. Those are suspended right now. I want to be clear about that. We have a larger public safety mission at hand, and that's why we're going to do what we have to do to preserve law and order in Lafayette Parish.
Well, what are you going to do about the one buggy, one person initiative? Is there any sort of way to enforce that?
That's going to be that's not going to be practical to enforce that. I'm aware of the complaints, and that's more. I would depend on the retailers to enforce that, and I would ask them to be responsible with the privilege that they have as a public retailer, especially our commodities, the grocery stores and whatnot. There may be some members of the public who, for whatever reason, either are unaware or maybe don't realize the importance of that. I don't see why you would want to expose more people to an environment like that anyway.
And are you seeing a similar reaction in more rural parts of the parish as in the city? Do you feel like it's being followed more in some places than other places, these 10 people limits?
I don't feel like there's any difference. There's no discernible difference so far. I think people are people, whether no matter what part of the parish or state or even world that you're in. Okay, thank y'all.
So again, Sheriff, thank you, and thank you for all that you do and your deputies, and I know there's a few deputies here, so I appreciate that and appreciate your service. Kind of just want to say something that I feel a lot of people are thinking right now in our community. This is not normal. It's not normal. Quite frankly, it's something we've never seen before. It goes against a lot of the civil liberties and civics that we've all learned in high school, 3 branches of government. The sheriff alluded to certain civil liberties, the right to peaceably assemble. These are all precious to us. But the first line of defense in this is it's not the government. I said yesterday, no matter how many proclamations we issue, how many tickets we issue, how many citations that are issued enforcing the governor's executive order or implementing President Trump's initiatives, no matter how many the government does, the first line of defense starts with you, starts with me, starts with us. So Neil, when you asked about the one person, one buggy, that's not a law. That is a plea from me to retailers and really from every local official across this country to large retailers to exercise common sense. We have Dr. Stefanski with us today. She'll tell you, or she can tell you, there's no cure to this deadly disease, this deadly virus. But there are proactive common sense measures that we can all take. Wash your hands. Exercise social distancing. Don't touch your face. All the things we hear every single day. So to our large retailers, to our small retailers, to businesses across this parish and across this region, Acadiana, implement the one person, one buggy rule. Implement the social distancing. A lot of retailers are doing this, and I appreciate that. So again, first line of defense, it starts with us. We are Lafayette. We are Acadiana. We will get through this. That being said, I will ask Dr. Stefanski, if you don't mind, to step up and answer any medical questions our community has. And also, before you do, Doctor, let me tell you something. We are so blessed. No, I mean this. We are so blessed to have Dr. Tina Stefanski here not only with us today, she is busy. She serves the entire Region 4. She leads our medical task force. The levels of preparedness that I implement from an administration, that we implement here locally, these determinations are based on the advice from the medical task force that Dr. Stefanski leads and the wonderful doctors on our task force. Every day we're in communication constantly, a couple times a day. So I can't thank you enough on behalf of our people, and we are very honored to have you serve us. So thank you so much. That being said, Dr. Stefanski, and thank you for your time. Thank you, Doctor.
Thanks for those very kind words. We're very fortunate in Acadiana to have wonderful parish officials like our mayor president, who are very interested and are really concerned about the health of their residents. So most appreciative to a great administration here in Lafayette Parish and really throughout this region. And one of the things, before I get to your questions, actually one of our local TV stations asked me to clear this up because they're hearing a lot on social media about medications that are available to prevent or treat this virus. And so, that's really false information that's being shared. So again, kudos to our local media for wanting to dispel rumors. And so there's something called chloroquine and hydrochloroquine. These are drugs used to treat malaria, lupus. I'm sure y'all have all seen these social media posts from physicians around the country. I haven't seen any from physicians locally that these medications can be used to prevent this virus. It's not true. That's false. In fact, these medications at levels just a little bit higher than would normally be prescribed can be toxic. They can cause cardiac arrhythmias and other really very damaging, can have very damaging effects on people's health. So people need to realize, we've had people call our office wanting to know if they should get these medications for their children to help prevent this virus. I mean, that is frightening to me. That this information is being shared, and that the concerned, scared public is looking for, of course we all are, right, a way to prevent and keep ourselves and our families healthy. So please, we want to dispel that rumor. Those medications, there are clinical trials for these medications. It's used for individuals who are hospitalized and under the care of a physician. So do not use these medications. Don't order them online. Don't fall prey to these tactics, scare tactics. It's really awful. And really that's it. I think the sheriff and the mayor president just so clearly that if you want to prevent this virus, your risk of exposure, your family, yourself from being sick, the best thing that you can do is stay home, avoid crowds. Our Acadiana Planning Coalition that the mayor president mentioned yesterday is very concerned regionally that we're seeing people in stores bringing the whole family, not social distancing, kids running around, people very close together, talking, hugging. It's really imperative that people realize it's not in their best interest, it's certainly not in the best interest of anyone in this community. And so do y'all have any questions for me?
Hi, I'm wondering about recovery. I know the Department of Health had added a recovery statistic to the website. So can you describe a little bit what it's looking like? And with COVID-19 patients, what does it look like when a patient is fully recovered?
So this is something we're learning a lot about. So here in Acadiana, I think we're a little too soon into this virus. We're just now really starting to see the increase in acuity or level of severity illness, essentially, for people who are presenting to the hospital. So I think those individuals, I can tell you this past weekend, we had a meeting here yesterday with the hospitals who are very concerned, again, about the level of acuity, how sick people are when they do reach the hospital emergency department because they're short of breath or their temperature rises. And so those individuals are hospitalized. The course nationally, what we hear about this disease is that people are very sick. Oftentimes individuals are in the ICU. A high percentage of those individuals are actually ventilated, so placed on a ventilator to help support their breathing, and they remain hospitalized and on those machines for a longer period of time than we typically see with other respiratory illnesses, which is why, I think one of the reasons we hear about ventilators and the importance and the shortage, concern about the shortage of ventilators, is because a higher number of these individuals are requiring respiratory support, and then they're staying on these machines longer to help support their breathing. So it's a very serious illness. It's much more severe than the flu. So I think we've all recognized that now. And in the United States, as the sheriff was saying, we're seeing younger individuals with serious illness. So, we were previously saying 80 and older, 65 and older, 60 and older. The numbers have bounced all around. And now we hear in the United States that younger people are at risk for serious infection as well. we have an unhealthy population in this country. We know that. We know we have a high degree of hypertension, diabetes, obesity, and those are the highest risk factors for severe illness. So it's really important that we do everything we can to reduce the level of infection or spread of the virus in our community, and that we try to reduce our risk of exposure. So again, we have the most giving community, I think, in the state. So anyone who knows someone who's older or who has these underlying health problems, we don't want them to go to the store. Shop for them, and try to help those individuals out to reduce their risk of exposure.
So, correct me if I'm wrong. I think there are some people that in the country that have recovered.
Yes.
And none
Yes.
in Acadiana.
Well, yes, we do. So it depends on the level of severity. So we definitely have had people in Acadiana. We don't have the statistics yet because, again, we're pretty new into this. Just a couple of weeks is new when you're looking from our perspective in public health. So we absolutely have had people recover at home. And do fine. Takes a couple of days. Some people do have a respiratory, upper respiratory infection. Symptoms very typical of an upper respiratory infection, and they recover after a couple of days. So the great majority of people do recover well, which is why we don't really know how many people in this community might have this virus and could then spread it to other people, because for the majority of people, it might be very mild symptoms and they do well. We talk to every individual who tests positive, so we call and do case investigations. And I can tell you, I've been surprised at some of the people that I've talked to at the degree of shortness of breath that the individuals have who are home and never in the hospital. So even though we say mild symptoms, these people are sicker than they are with the flu and at home. And so, again, just don't want to minimize it. For many people, it is very mild symptoms, but in some people, even though you might not seek care in the hospital, it is still a very scary illness for people. And we just can't, again, underscore enough the importance of trying to reduce your exposure, because we don't know. Most people have these underlying health problems, but there are some cases where people don't have those typical risk factors and may end up with a more severe case.
So would you say, and maybe this is information coming from their
Yes.
primary care physician, but would you say, let's say the symptoms stopped, would you wait maybe 2 days, a day before you would figure that you were recovered?
So what we're telling people is for a week after the onset of symptoms. So when your symptoms start a week after, as long as you have 3 days of no symptoms, so 72 hours, most people are considered free from transmission to others. So usually most people within about a week or recovered, again, symptom-free for 72 hours. And that's a typical course. Those individuals who are most likely to end up needing hospitalization, usually their symptoms worsen, and at about day 7 or 8 into the illness, they start to decline, and that's when their symptoms might worsen. So when we're talking to people, we tell them, look for that day 7, 8, 9 after illness onset, and if your symptoms worsen, you need to call the emergency department. Some people worsen much quicker than that.
Okay. And I think some media outlets are getting complaints that we're not telling the whole story, we're not reporting the numbers of recoveries. Do you know when there will be a time where we are reporting those numbers?
No, I think, for us, I can tell you from my perspective, the thing that we need to prepare for is situations where our hospitals are overwhelmed and not able to care for people. So that's the important information. And that is what should be important to all of us, because when we look at planning for a surge on our healthcare system, like we've never seen before, like we're seeing in New Orleans prepare for, like New York is in the midst of, that is a different delivery of care than we're typically than what we deliver every day. It's not where we want to be. So what we want to do is monitor the severity of individuals. We monitor our ICU capacity, ventilator capacity, and that's where all of our efforts are on looking at, again, the sickest of individuals and making sure that our healthcare system can care for those individuals. And then hopefully over the next couple of weeks, we'll have enough information to be able to give a bigger picture of how many people were tested, how many people recovered fine, and how many people needed hospitalization. It's just we're so early into it. I know it feels like we're not. Believe me, I know we all feel like we've been in this, forever. But from our perspective, we just don't have enough information yet to be able to reliably share that with the public. I think it would be misleading at this point.
Do you think we'll start seeing a difference in the numbers from these stay-at-home precautions that you started to take?
It's a great question. We're really hoping. And then, so the people that we're seeing now who are entering the hospital for care or who are testing positive were probably exposed about a week or week and a half ago, maybe up to 2 weeks, just depends on when they were tested and how long it took to get those results. So what we're hoping is that over the last couple of weeks, if people really try to stay at home and avoid exposing other individuals or being around other individuals, that over the next, in the next 2 weeks, maybe we'll see it lessening, of the increase will slow down, essentially.
I did have a question from a viewer who asked, should they be worried about, food workers who are handling their food and then, that they could possibly get it spread through ordering food takeout or drive-through?
I think our restaurants are well aware, of that's probably the group of individuals who's the best educated on how to prevent the spread of infection to other people, because this is food handling is highly regulated. We inspect them. They know they could probably teach all of us about hand hygiene and those kinds of things. So I would not be overly concerned about that. Again, the greatest risk of transmission is from face-to-face what we know, face-to-face contact. So it's not known to be transmitted through food or water. It's again that face-to-face contact with someone who is coughing or sneezing, and those droplets might then land on you. There is some concern, of course, about surfaces, but again, that person has to be coughing or sneezing, and those little droplets land on the surface.
Is there a shortage of PPEs? We're hearing that some nurses at hospitals only are given one, maybe not at all.
No, so not in this region. We don't have a shortage yet, but of course we're looking ahead, and there is definitely concern that if the level of admissions to hospitals continues at the pace that it is, that we could be in a position where we have limited PPE in a couple of weeks. But the Centers for Disease Control has issued measures to try to help prolong PPE use. So there are so in healthcare we are doing things a little bit different than we typically would in order to preserve the PPE supplies so that we don't get to a point where we're critically low. So that's where you may see where a healthcare worker might reuse a mask that they wouldn't typically use, but then there's guidelines on how to do that safely for the healthcare worker.
Has the number of pending hospitalized cases been increasing? Hospitalized pending cases, I'm sorry.
Gotcha. So has the number of people admitted to a hospital who are suspected, has that number increased? Is that your question? So we have continued to see an increased number of people present to hospitals with symptoms suspicious or concerning for coronavirus.
Do you have a sense over day over day?
No, but I don't have that right now, but I can. The next time I see y'all, I'll try to have that information.
I know we've had less people coming into the Cajun Dome screening site every day. Would you attribute that to anything? You think most people came in at the beginning and it's trickling off, or what do you think's behind that?
Well, it's hard to speculate, but I will say that more communities around Acadiana, so the Cajun Dome stood up first very early, which again, great collaboration between Consolidated Government and Lafayette General and Our Lady of Lourdes. And so now other communities around Acadiana over the last couple of weeks have also stood up these testing facilities. So throughout Acadiana, there is more access. So I do know that lots of people from outside of Lafayette were coming into the Cajun Dome. And so I think with these other communities stepping up testing sites, and with hopefully the testing supply being better in private provider offices, urgent care clinics, there's a little bit more access to testing in general.
They started posting how many tests from
Each parish.
public labs versus the commercials, and I was a little surprised that St. Martin Parish, which has 3 deaths, as of noon today, has had no state health office tests.
Yeah, so the lab, so now the state is posting by parish the number of state labs run, the number of commercial labs, and the number of cases. And so it is in some parishes they just preferred to use their commercial lab connections and contracts. And so in some parishes you did have more state lab testing done, and others it may be more commercial labs through the hospital systems. So St. Martin also has a very small hospital. So the state lab testing is really focused on testing individuals who are hospitalized. And so that's the other reason. Commercial labs, have typically been used for in outpatient settings, and inpatient in hospitals. We're doing more state lab tests because our state lab had a quicker turnaround initially. And so that's probably another reason why you don't see any tests, because their hospital is very small, limited number of individuals admitted there.
I'm still getting a lot of emails from people complaining that the test results are taking so
Yes.
long to get back.
Right, so the test results are coming back quicker is the good news. Unfortunately, for some individuals who were tested a little over a week ago, one of the labs was overloaded. And so we really suspect that they're just still in queue. That lab shifted and has a second lab open. And so lab results are now coming back much quicker. So I can tell you, for example, the Cajun Dome, we're getting results back in a couple of days. But there are some individuals who were tested over a week ago and they still don't have test results.
Test counts. With a state test count,
Yes.
we have like 3,400 tests run in Lafayette Parish, and like 5% of that in Acadia and Iberia Parish. What's the disparity there?
Well, it's just, I think when you have greater access to testing, which we had in Lafayette Parish, you have more individuals who are tested, and so you would expect a lower percentage of positives. So yeah, you're right. In some parishes, they have a high percent positivity rate of testing, but it's because you had much fewer individuals tested, and so you really limited, that testing was really limited to those individuals where there was a high suspicion of this virus. So although in Lafayette Parish, we did screen for that, of course, the more individuals that you test, it's gonna alter that percent positivity rate.
Said one of your greatest concerns is overwhelming the hospitals right now. I know the governor's requested 14,000 ventilators and he's only gotten a couple hundred at this point. Is there a worry that some of the areas that are later hit in the state could suffer from just lack of ventilators, even greater so than some of the first hit areas?
So I can tell you we have a wonderful, wonderful governor, a wonderful state health officer, and so I absolutely believe there'll be equitable distribution of resources as communities start to see a greater load. We're not at that point yet. We know we track ventilator capacity daily. They're monitoring that daily, and so I really have no concerns about that. I really do feel that there will be an equitable distribution. Of course, it depends on what we need to get that supply into the state. Everyone in the nation is facing the same challenge.
Thank you. Is the state doing, like, we're talking about, we're kind of trying to peer into the future and get an understanding of where we're going. I mean, are we doing predictive modeling to understand what's happening?
Yeah, so there is a modeling cell at the state level, and so I'm hopeful that by the end of the week, maybe there'll be more, some of that information will be released. And we don't have it either. I don't have that modeling.
Will that be available at like a regional level, or will it be kind of
I suspect it'll be at the regional level, is what we hope. I don't have that information yet either. We're all in that cell too is balancing the information that we have to date with this with the effects of social distancing. So this is new to everyone in the country.
Can you speak a little bit, if you can, about the methodology involved? I mean,
No, now that I can, I'm not a mathematician, so I cannot. No. Anything else for me? Thank y'all. I appreciate it.
I'm sorry.
One more.
Nobody else. I didn't want to cut anybody off. Lastly, do you have any updated figures, like percent of hospitalized folks that are on ICU? That are on ventilators, ICU, that kind of thing?
We have that data, but I don't think I'm able to share that publicly. So you can bet we're tracking it daily. And so we have that information, but it's just not something that we'll release at this point. But I will check to see if we can in the future.
Are y'all in the process of looking at sites for once we reach surge capacity where we could spread out, apart from that, so like New Orleans is doing with the convention center?
So we're looking at all kinds of options for exactly how to surge within this region in a manner where we deliver the best medical care to individuals.
Now, can you explain what you mean by surge?
Sure. Yeah, surge is something we plan for all year long. We've been planning for years. You heard Dr. O'Neill mention we have a great healthcare coalition here in this region, and so we always there's methods. There's well proven techniques for surging. Meaning, so surge means when your healthcare system has to expand its capacity to deliver care. So where the numbers of people needing hospitalization and care exceeds the typical capacity that you have, the typical number of beds. So without going into too much detail, because that's really for the hospitals to discuss their individual surge plans, but we're actually looking at it as a region. Hospitals surge, they add beds. You hear around the country, the same is true here, where hospitals are finding alternate places within their hospital system and facilities to expand ICU capacity, so ICU beds, inpatient beds. So again, looking at atypical places within a hospital where you don't normally have an ICU bed, but to stand up and add additional ICU capacity within your facility. And so we're actually looking in this region as a region how to best do that. So increase surge within the facility, and then how to start moving patients around into alternate care facilities. So level hospitals that might not typically take these individuals to then spread the delivery of care out throughout the region, so as not to overwhelm one facility.
Yeah, do you have a sense of how the hospital Marshall Plan and the CARES Act is going to get distributed down into the states? I mean, like whether or even who would know that?
Level to the guys at the state level who are working to distribute again resources.
Because I asked you this off,
About
off
mosquitoes?
camera,
Oh, no.
because people are still responding to my story from yesterday about why can't y'all release more details about
Sure.
where
So,
the cases
so a lot of
are.
questions about why we're not releasing zip code data of cases, and so I absolutely will not release that information, no matter how many times someone asks me. Protecting an individual's privacy is of utmost importance. And actually, there was some information being shared not within this region, and I called to report that to the individuals at the state level, because once you start reporting zip code data, then there's a greater chance that an individual or their family could be identified. And that is, and that's number one, of course. And also, it, I think, lends a false sense of security. So if you have one community where there's a greater number of individuals who have been tested as opposed to another, so I don't want to even use hypotheticals here, but so if you have, say, community A where there's a lot of testing, and so it looks like there's a lot of cases in that part of a parish, and then this other little community where people just have not been, for whatever reason, had access to testing. Maybe they don't have transportation. They're just not aware that there's some these testing sites available. So, of course, this community, it's going to look like you have a lot of cases. And this community, it's going to look like there's not much going on. So these individuals may think, well, it's fine for me to go out and about and expose myself to other individuals. We can gather. There's not much happening here. We don't know that. That would actually be bad information, because they just have not had access to testing. So I think it also lends a false sense of security. And it also will target a community. So if we see a lot of cases in one community, people may think, oh, there's something going on there, and that may again negatively impact individuals in that part of a parish or a community. And so what we do look for all of the time is clusters. And so when we identify clusters of cases, we are working with parish officials, with whatever, not to give much detail, but wherever that cluster is, we're working with individuals who can impact and stop or slow the spread. So we're always looking for clustering of cases, working with our local officials to say, hey, this looks like a pocket or an area of concern.